Welcome back to Avid Sports Medicine as part of our lower body youth prevention series and recovery. So we're going to go over knees today. So hips and knees, really important, especially for our lower body athletes who are constantly moving and changing direction. Knees, we're going to talk specifically about rotation at the knees. Now we all know that the knee flexes and it extends, right? It bends and straightens, correct? But do we often forget about rotation? That hasn't been talked enough about, in my opinion, because a lot of injuries are rotational injuries that happen at the knee. You've heard of the ACL, you've heard of some other ligaments in the knee, and those are really rotational injuries, and usually they're non-contact, meaning no one's done anything to hit the knee. It's more about planting and cutting, and then we feel some sort of level of breakdown at the joint. So we're going to address the joint and try to make that joint a little bit more resilient. So one of the things that is, I need to warm up my muscle tissue and all of that, but I also need to warm up my joint spaces. And so we're going to address that today. So the first thing we'll have you do is Liz is here in a perfect position. We're in a bent knee position with our heel on the ground and the foot is upward so that the ankle makes a 90-degree angle here. Now, she's holding onto her thigh because she doesn't want her hip to rotate with her. So she's going to make sure she stays nice and stable. And then what we're going to do, I have a line here to show you that her shin is now going to rotate in one direction and then into the other direction. Now it looks like her ankle is doing the work, but really she is gathering some tension from her hamstrings because the hamstrings are what rotates the knee primarily, both inside and outside, right? So as she rotates inside, she's going to pause and she's going to make sure she can feel the inside hamstrings here and that they're active. And then she's going to rotate to the outside or externally, and she's going to make sure she can feel that outer hamstring engage as well, okay? So you want to make sure and do this both sides so that you know where your limitations are, okay? Left versus right. We all have those minor limitations, right? Because we have a dominant side and a non-dominant side. And we want to make sure that they are as symmetrical as they can possibly be. So by rotating and getting a sense of, okay, I'm feeling everything that I'm supposed to be feeling, hamstrings are working, I'm actually able to move from the knee versus from just the ankle, because this is all one unit moving together, okay? Now we can add a little bit of tension to it. So she's going to internally rotate or rotate inward. She's going to pause when she feels like she can't go any further. Then she's going to hold on to that thigh, and in that internally rotated position, she's going to extend her knee, right? And then she's going to pull it right back down under control. And she's making it look easy, but it's actually more difficult than it looks here. And then she's going to extend again as she rotates outward. She's going to keep that ankle locked in, and then she's going to continue to pull back down, okay? So again, rotate inward, pause, make sure we're at our full in range, and then she's going to extend, and then she's going to pull back down. And when you're done doing knees, okay, it should feel like your knees just went through a pretty significant workout, okay? Now, we're gonna combine everything, okay? So now what she's gonna do is she's going to internally rotate, she's going to extend her knee, she's going to pause. You may not fully get to the full straight knee, but then we're going to externally rotate, and then she's going to pull back down. So now we're making this circular motion with our knee joint, correct? So again, internally rotate, extend or straighten the knee, pause, externally rotate, so she's rotating and pulling back in. And then we're going to reverse it. So now we're going to stay in external rotation, extend, and this is the tougher one, internally rotate and pull back down. Now, how many times do you do this and when do you do that? You want to do it before activity and post activity. Again, prevention and recovery. So you want to do at least 10 per side. You can just start with rotations and then you can work your way up to flexing and extending the knee. So give these a try, drop it in the comments, let us know what you think.